Good morning, everyone. Thank you for joining us for our webinar on improving outcomes and well-being for moms and families. The conversation is vital now more than ever, and I'm extremely encouraged by the outpouring of support that we've had for this program, record high interest and registration. So thank you all for being here today. The statistics are sobering. We're going to cover a number of them, but definitely timely. This coincides nicely with Mother's Day, Maternal Mental Health Awareness Month. Moms First had, I think, their first annual summit held yesterday, and countless other activities that are existing this month and beyond to raise awareness about challenges that moms face and what we can do about it. For those I have not yet had a chance to meet, I'm Sarah Moore, Vice President of Business Development here at Benefit Bump and a self-proclaimed advocate for moms. And I'm joined by my colleague and founder of Benefit Bump, Scott Liebman, longtime benefit consultant. In true Benefit Bump style, we will share refreshing or research. I don't know how refreshing it is. Those are research findings related to drivers of poor maternal well-being and outcomes, with a focus on, this will be refreshing, what employers can do to address those policies, through policies, programming, and support. So we'll start with the state of maternity outcomes in the U.S., why employers should focus on maternity care, how to get expectant parents engaged early in the process, because that's important, what has been proven to help improve outcomes, and then what employers can do to help bend the curve. Housekeeping, I think I mentioned, sorry, Scott, just real quick, we're going to record the presentation, provide the deck. For Q&A, please send questions directly. We hope you have many as we go through the discussion. Send those directly to April Chan on our team. She is going to be compiling those and then bringing them to us after the discussion. So with that, I'll go ahead and get started. It was not hard to find the plethora of stories and challenges faced by women in this country. These are just a very few and small number of headlines of celebrities, women of high wealth and high status that have struggled with postpartum depression, prematurity, racism, maternal mortality. It's alarming what's happening in this country, and very grateful to the women that are speaking out, again, with status, to shine a light on what a number of women struggle with, but stories that aren't being told. We'll start with maternal mortality. So I'll sort of be, unfortunately, a little bit of the doom and gloom with reality of where we are, and then Scott's going to follow up with much more of the brighter, shinier, more optimistic side. But to level set on where we are with maternal mortality in the United States, it's abysmal. We are underperforming other OECD countries. So if you look at the chart on the left, this was pulled from Aftershock, a documentary that I highly encourage those of you that have joined us to watch. It's about sort of the challenges that moms face, racism, all sorts of things that drive poor maternal outcomes in this country. And the chart shows that the countries at the bottom are performing very well. And as you see, where the red arrow is the United States. So we are all the way at the top, performing very, very poorly compared to our OECD countries. And I think there are a number of different drivers of poor maternal outcomes for moms: racism, mental health challenges, socioeconomic factors, so affordability and access to care. But one of the most astounding things as we were putting this presentation together is the fact that 4 in 5 pregnancy-related deaths are preventable. So there are lots of things that we can do to bend this curve, but we've got to start now and to focus on improving those 4 in 5 preventable deaths and driving our place in line on the chart lower down on the left-hand side. Prematurity, we've been actually losing ground over the past decade despite awareness and efforts that have been made. So not saying, right, you see the trend in the curve or on the chart over the past decade continues to climb for premature birth rates in the United States. again, which is absolutely alarming because we are raising awareness. We're starting to talk about these things, but need to start adopting measures in order to drive them down. I do want to point out, as Scott, I think you and I do sort of throughout this discussion, that prematurity rates are higher for women of color. And so really being mindful of that, but absolutely existent and prevalent throughout women. Lots of different drivers of the prematurity, maternal age, again, social determinants, like we talked about before, access to care, affordability of care, and stress and anxiety. We'll focus a lot on stress and anxiety and how that contributes to poor outcomes, because there are definitely tangible things we can do to drive that down. Last sort of piece or it's, I guess, 3 out of 4 pieces I'll bring to the table, but maternal mental health, right? So we've covered mortality, we've covered prematurity. Maternal mental health challenges are also prevalent in the United States. Katie Couric yesterday in the Moms First discussion shared that 50% of Black moms that struggle with postpartum depression are going undiagnosed. And you see some other stats on the right-hand side, just having a hard time finding and rooting out those emotional health challenges. Currently today, moms are being screened for postpartum depression at those doctor's appointments with the pediatrician, where there's not an established, mom doctor relationship with the pediatrician. There are typically other things going on, weighing of baby, talking all about the health of the baby. And so neglecting kind of mom in that equation. How can we flip the script there? And Scott, I think also talking about what drives maternal mental health challenges. Inequities exist with regard to where folks live, access to care challenges, age. Breastfeeding is a big challenge for moms postpartum and definitely drives poor maternal mental health, prematurity, right? When babies are in the NICU and moms are being discharged and told they can go home without their child. A number of challenges and factors contribute to maternal mental health, especially postpartum. So to round out the discussion, a few more stats. It's a complicated landscape that moms go through as they're growing their family and returning back to work. So some other things that contribute to the poor outcomes we shared. There's absolutely a lack of paid time off for a number of moms in this country. 1 in 4 moms goes back to work 2 weeks after having a child, and that is absolutely too soon. Childcare struggles and affordability. So 4 in 10 parents are going into debt to afford childcare. Breastfeeding challenges. There are a number of different statistics on the challenges of breastfeeding. 75% of women struggle when breastfeeding and going back to work. I won't sort of belabor the different boxes on the screen, but it's a lot of parts and pieces that folks go through, different challenges, and then when they all sort of meld together, you can see where the train sort of gets off the rails. And so with that, Scott, I want to pass it to you. I've done sort of maybe some of the level setting on the challenges, but we really, really want to get to the solutioning around this, because it's imperative that we start adopting these measures. So Scott, we'll lighten it up a little bit and turn it over to you.
All right, sounds good. Thanks, Sarah. So, that for us, one of the really important things to communicate during this is just all the things that employers can impact. So there are countless other studies that really get at other clinical factors and other things that might be needed from the healthcare system. And it's all part of the equation. And one of the reasons it's so important to employers is about 1 in every $5 you're spending in your medical plan is going to family building. And then the other thing that we're hearing from a lot of groups right now is just that there's been a major demographic shift in the workforce. So as we start to see the baby boomers move out, some of the early Gen Xers starting to retire early, employers are looking at their census and they're seeing that they've got a lot of Gen Zs and millennials and others that are in that family building stage. So really trying to figure out how to better support them. We're always looking for like who's doing cool stuff, what are the things that employers are focused on, and really even just looking at that gap between maybe intent and action. And so commend the Purchasers Business Group on Health. It's a group of very large employers. It includes folks like Walmart and Apple and Intel and Boeing and others. And they've been doing a lot of work around this kind of idea of a common purchasing agreement and shared goals. And so just to kind of pull a few out of what they talk a lot about, um, is really around how do we get folks engaged? So how do you identify individuals within your data set, within your population that are having a child so you can intervene early? And because most maternity claims are case rated, using claims data to find pregnant people is usually too late. The other thing, which is like countless studies have really focused on, is just how hard it is to navigate both care and resources when you're growing a family. It's a lot of different things that folks have to find. And a lot of times they're doing it on their own when, at the stage of their life they're in, they might be benefits naive, healthcare naive. And then really looking at the way care is delivered. So there's a stat I'll share later around just the disparities in outcomes, but also just thinking about birth preferences. So, a lot of interest in adding doulas into the care equation, folks working with midwives who might have more availability and can work very closely with folks who want alternative places to deliver, and then try to find a lactation consultant in your health plan's provider search. That's not easy, and so really making sure that folks are getting to the right providers. So this next section, I'm going to talk about what the research says in terms of what can improve birth outcomes, and again, with a focus on these are things that employers can do. So these aren't necessarily things that we're going to rely on the health system to do. So really centering them in on 4 big categories, and then I'll have a few other bonus items as well. But something that consistently studies are finding contributes to better outcomes is childbirth education and birth planning. Second is really having doulas in place to make sure those birth plans are followed. The third item we're going to talk about is improving workplace support. So there was a graphic or a stat on an earlier slide that job precarity increases the probability of low birth weight children by 48%. And that job precarity is all the things Sarah talked about in terms of, concerns about leave policies, work schedules, livable wages. It's a number of different categories. And then for those of you who have heard our presentations before, this idea of really focusing on stress and anxiety, the root cause stressors. I don't know. I guess I'm still fascinated that there's 80 plus years of data that indicate that this should be a primary area of focus. And it does feel like the market maybe has not necessarily hit it yet in the way that it needs to. So what is the value from focusing on these things? So childbirth education and birth planning reduces C-section rates, which is great from both affordability and a health perspective. When the doula is there to help, really support that birthing journey, and especially as it relates to making sure that folks have a birth plan and have that birth plan followed. Lots of different studies in this topic. So not only reducing C-section rates, but reducing the probability of having a low birth weight child. There was one study that showed that reduction was 40%, reducing birth complications, so cutting those in half. So a lot of big opportunities there. When we looked at that study around job precarity, it was interesting because what they said is that as employers layer in more workplace support, so as they kind of take down these issues that are causing this degree of unsettling for employees, it reduces the risk of prematurity or low birth weight children by 17%. So each of these tranches is really chipping away at that issue. And then there have been studies that consistently have found that as we bring down the level of stress, as we help people address those sources of anxiety, then we're going to lower preterm birth rates because not managing that is a big issue. And a stat that I also like to quote, which I think is interesting because it's a group of Canadians who are supposed to be a lot more laid back than us Americans, but 72% of expectant parents in this Canadian study had moderate to high levels of anxiety. And I think when we look at US workers, those numbers are just off the charts. And then, just layering in one other thing around workplace supports, but there have been countless studies that have shown the value of paid parental leave. So making sure that mom has time to bond with the baby, and also spouses and partners do. So the health outcomes that are derived from those investments actually are longitudinal. So it's not just that first year of life, but many of those studies show that impact is perpetual. So just to layer in a few more things, so most of you have fitness and nutrition either covered in a wellness plan, or maybe their dietitian's covered under your medical plan. But really, helping folks with understanding the impact of those. About 1 in 6 women will end up on bed rest during a pregnancy, and unfortunately, bed rest is actually inconclusive as to whether it's reducing prematurity rates. And then part of that is because it impacts other risk factors. So even just thinking about exercise throughout the pregnancy for high-risk folks is really important. Monitoring of high-risk factors, that has been the popular approach used by most programs historically. Actually, the data suggests that a lot of those interventions are really not more effective than self-monitoring of these same issues. There are some emerging technologies that are and approaches that are showing promise, that are actually increasing the impact over what we'd seen before. And then, just to dig in a little bit more on this issue of race, and also, circling back to birth advocacy, you know, a lot of moms feel like they're not being listened to as they're seeking care. That sometimes OBGYN can be intimidating. I, as a dad, felt that way. I don't think I ever walked out of a prenatal appointment not being worried about something and not feeling like we didn't have enough time. But when you look at women of color, those impacts are more pronounced. About 20%, depending on state, but about 20% of folks are not receiving prenatal care in the first trimester, and that number's notably higher for Black women. So another major opportunity. And then there was a study in New York City that found that the difference between adverse outcomes from the worst performing hospital to the best performing hospital was 7x. So just think about like that choice of hospital could impact whether somebody had a 7 times higher probability of having an outcome that resulted in either a mortality or morbidity issue. And so in terms of like, again, following the data, what does it tell us to do? It really speaks to how important advocacy is, and really helping people with, making sure their birth preferences are met. So kind of doubling down on doulas and midwives. Probably worth employers looking at prenatal care like they've looked at maternal health over the last few years. Maybe we need to not only look at, what the cost share is, so is it affordable for people to seek care, but also are your employees able to take time off to get the care they need? The state of New York, I think, just passed legislation that permits pregnant individuals to get 40 hours of paid time for prenatal visits. So that's a great start, something employers can emulate. And then also look at performance-based contracting with hospitals where you have big population hubs, or partner with your local health plan. But it is scary to think that in any given community, we have hospitals that are performing a lot worse. And those hospitals are typically network providers. And so, definitely work with your consultant, your health plan to see if there's a way for us to kind of change the way people access care. So I will do my best not to make this a commercial, but I want folks to know that the reason we built Benefit Bump and the way that we continue to evolve Benefit Bump is based on what the research tells us, what our participants tell us. And so I want to really link back to some of those issues that were identified earlier around how do we help people navigate all the resources they have. Interestingly, MetLife published in their most recent benefit survey a section that they called life experiences. So it was really looking at how employees felt cared about during major life experiences, one of them being welcoming a new child. And there was a pretty meaningful gap between how employees felt and how their employers felt they were supporting them, to a tune of, I think it was like 19% gap. And in terms of the folks who felt less cared about or not cared about, one of the things many of them said, so 38% of them said, was it one of their sources of frustration was they felt like they weren't informed or knew how to access a lot of the opportunities that could have made the experience better. And we get that it's hard because, just this graphic alone shows a sampling of all the different things that a growing family or young family have to figure out how to navigate to either build their family, be able to pay for the building of their family, seek the work life support and mental health that they need, clinical supports, time off. And then when you look at the gaps, so, that's just what's covered under the plans. There are other gaps that need to be filled, especially as it relates to those social determinants that in so many of the studies are showing are such a major impact. And so how do folks access community supports, charity care, additional well-being resources? So who's giving them guidance other than Dr. Google around, nutrition and fitness and the financial stress that folks are under. Another stat that those of you who've been with us before have heard, but half of expectant parents are living paycheck to paycheck, and these are the ones with jobs. 18% are in active financial crisis, so budgeting all the different financial resources, and then helping folks with having a plan. Some of that anxiety is clinically related, but some of it is related to how am I going to go out on leave? Is my job still going to be here when I get back? What does my return look like? What if I choose to breastfeed? Is that going to be possible? Can I afford childcare? So really helping people with having a plan. And as the kind of experts have pointed out, folks who are seeking care need an advocate. And the advocate really can't be customer service or something that I think we've historically relied on, or overworked maternity case managers at health plan healthy pregnancy programs. It really needs to be folks that people can create a relationship, connect with, and individuals who are committed to providing continuous support. And so, like at Benefit Bump, we use master's level social workers and midwives and doulas and others who really understand this journey, who have that background, who are able to provide continuous support, and also that have done the work in advance to know what the resources are that people should be finding and using and helping them find those. And then I think they should be human, like, creating that connection. We found that our participants on average will work with their navigator on 11 different issues. If we totally relied on chat and AI and other things, we're going to miss a lot of opportunities that get decoded through human interaction and discussion. And the result for us has been significantly better birth outcomes, really happy employees, folks who feel less stress. We just refreshed some data around the percentage of folks who felt confident navigating their employee benefits, which is now up to about 90%. So once they know what they are, how they work, and have an advocate, it makes a big difference. One other stat not on this slide that I think is really interesting is when we looked at our participants who engaged with navigators and worked through a birth planning process with our team, the premature birth rate was actually 4%. So these are meaningful impacts from a family perspective and in life in general, but also as consultants and as plan sponsors, think about how much money that you'll be able to save and redeploy into maybe some of the other interventions that we'll talk about on the next slide. So maybe, Sarah, I'll let you kind of kick us off with good, better, best.
Happy to do so. So this is my favorite slide just because I sometimes can't stand sort of when problems are talked about and there's not tangible action items like, okay, thank you for educating me, but now what can I do to support and solve? So really appreciate from my perspective that we've sort of broken it down, and hopefully you all do as well. But just to get started on the good things that as an employer or for the consultants on the call, your clients can do. Step one could include creating a very easy to understand, easily consumable document resource that outlines from a leave perspective, fertility perspective, medical plan, childcare, financial resources, emotional health, all of the things that could be very beneficial for a mom, a parent that's going through this journey, and how to access what the resources are and then how to access them. And including if there are doulas or midwives baked into health plans or things like that, how that works, and that it is even available and an option. Secondly, ERGs are so vitally important for moms to get support in their employer communities. A great way for moms to connect, parents to connect with other parents, with other moms in that employer, understand, how certain things work. And then from a culture perspective, what else is needed? What else could be provided by the employer? A great sort of um, focus group, if you will, also on the perception of things and what else can be done to further support. Lastly, flexibility. I know if you've joined our webinars, it's or just paying attention to articles in the news, flexibility is key and core to retention, especially for parents, especially for working moms. I can't tell you how many days off for snow, for teacher development, or just general sort of random holidays that exist. Summer is about to start, and I can tell you, having two kids, it's insanity, the number of summer camps to juggle and gaps in care. So very thankful to Benefit Bump and other employees of their employers for that workplace flexibility if you can provide it. We encourage documenting it so that it's equitable and very clear to an employee across the organization what's available. But it's absolutely essential for working parents, especially in these days and the juggling and struggling of trying to put all of the different pieces together. And when we talk about sort of throughout this good, better, best, a number of these things, Scott, as you mentioned, are those situational stressors that drive poor outcomes in mental health and prematurity and productivity and all of these pieces. So just wanted to reiterate, right, when there's childcare gaps or when you're not understanding all of these different pieces, that directly contributes to those situational stressors that we outlined. So I'll pass to you to go through better.
Yeah. Yeah. So I mentioned this earlier, but looking at your insurance coverage, so most plans are covering midwives, but often you'll see inadequate supply or not a supply of birthing centers. So really looking to see what some of those options and resources are. Most plans are not covering doulas now. They're not in the network, but there are definitely companies that have emerged that have created doula networks that hopefully health plans will start to integrate into what they're doing. Sarah mentioned creating community. The other thing that we've seen that's maybe a step up is actually having facilitated discussions. So bring in experts, educators, consultants, others who can really facilitate a discussion to bring issues to light and help people work towards solutioning. We've created some modules for some of our clients. Happy to share those. The third one is really around antepartum leave. So because there are so many poor outcomes, unfortunately, it creates a lot of scenarios that I think are challenging for employers and especially for employees, where folks may need more time off, but not because their short-term disability was extended for a clinical reason, but because maybe their baby's still in the NICU, or maybe they're really struggling with the adjustment or their mental health or other things that aren't approved on the claim side, but maybe employers can accommodate to help facilitate a smoother and better recovery. And then, FMLA and a lot of state laws have established a minimum level of job protection, but it doesn't mean employers can do more around providing assurances and providing flexibility around protected leaves. I don't know that a day goes by or a week goes by that we don't have participants that, are really highly concerned because they're going to give birth to a child in that first year of employment and are worried that in the lack, with a lack of job protection, that, their job is likely to be eliminated or won't be there when they get back. And so, really hitting on that, again, job precarity challenge. And then Sarah, I'll let you round this out with Beth.
Yeah, and just wanted to address, so ERG stands for Employee Resource Group. Just because we have that up on the slide, wanted to unpack what that was. So going to the best side of things, I guess not surprising that we think our solution is an integral part of driving down, just again, because of health literacy challenges, lack of resource understanding and utilization, the need for proactive birth planning and childcare planning and all of these different pieces, again, that reduce stress. So definitely we see some good results, and as a low cost way to drive some of those initiatives and some of those different trends down. Direct subsidies for doulas, you know, talked about trying to push health plans to continue to expand coverage for midwives, doulas, birthing centers, lactation consultants, but without that coverage that currently exists through the health plans, we have seen employers with more and more interest in subsidizing doula care. And again, the cost of that sort of the ROI is truly there to help impact those prematurity, NICU stays, and all of those things that can be high cost drivers for clients. Mental health resources that are focused on growing families, you know, lots of EAPs and supplemental mental health resources that exist, but definitely want to highlight the need for tailored content, because that generalized sometimes, right, the same EAP practitioner could be touching a very, very broad range of issues. And these issues that moms or parents face are nuanced as they're going through the growing family phase. So best practice would be to focus mental health resources that have that subject matter expertise. Establish emergency relief funds. We've seen clients do this for folks as they're going through these major life events and need help on the financial assistance side. It can truly impact, again, that continuum of care, access, and those stressors. ACO relationships with high performing hospitals and communities, establishing those preferred relationships is imperative in driving to preferred providers as well. And then lastly, Scott, as you mentioned on the just having time to care for yourself and for baby. I know we mentioned paid leave and additional postpartum leave, but then also prior to delivery, ensuring, like New York is doing, that employees have time to take off to go to doctor's appointments. So accessibility, affordability, and part of that accessibility is making sure folks have the time off to go and see providers.
Right. Well, I know we're 33 minutes in and we wanted to give some time for Q&A. So if folks have any questions, please share them with April Wagner. If anybody would like to come off mute and ask a question, please, I guess, raise your hand and we'll find you and take you off of mute. So April, did you receive any questions as we went along?
Yep. Yeah. So the first one I received was, can you share examples of programs that are successfully tackling these issues?
Well, I think in bits and pieces, I was actually reading about one, and maybe I'll talk about that because it's maybe adjacent, but CMS just created a program they called Transforming Maternal Health, which they rolled out at the end of last year. And it was really focused on the Medicaid population, but it has a lot of these components, which is why I think it's relatable. So, families are paired up with a social worker who's helping get to know them and kind of guiding them through the care system. And then the government's also subsidizing doulas and midwives who are providing supplemental support beyond the OBGYN, to help them with, self-care and prep and kind of keeping them on track with prenatal visits. And so I think it's interesting because it's things that employers could do, maybe driven, by the employee requesting them. But all right, I was going to resist making a joke, but the government's investing in this. So like they're spending money in a category that my assumption is because as they're trying to manage Medicaid spending, get it out to more people, they also agree with the evidence that there's meaningful savings available as well as, positive outcomes. We have other employers, maybe a great example of a client of ours that's really driving to preferred providers is we partner with their employees to educate them on the differences in outcomes between two major hospitals in their largest location. And then, there are incentives that employees can earn by delivering at the preferred hospital, as well as, engaging in the support model that we provide. So that's a good one. And then we have some clients that are subsidizing doulas through a direct reimbursement. So I think lots of examples, but in terms of pulling it all together, I think that's still emerging.
And one other place too, Scott, that I know we talked a lot about the PBGH and their initiative to transform maternity care. And maybe one thing I should have mentioned that might be helpful to folks on the phone is they just released their common purchasing agreement, which has a number of these pieces driving to preferred providers, care navigation, making sure employees know about resources, making sure doulas, midwives, birth centers. But for folks that are interested in that document, I believe it's publicly posted and that we can share. I'll triple check that and maybe we can include a link, Scott, if you think that would be helpful for the audience as well, and just kind of reinforces some of these aspects.
Yeah, I will put the link in chat.
Great.
While you do that, another question we received was, how would we measure whether the programs we currently have in place are working?
That's another great question. Yeah, because I think back to just kind of maybe the maternity reporting that we've historically received, which a lot of times focuses on like large claims and pure stats. The technology we have now around reporting really does enable some pretty cool stuff. We've worked with a number of consulting firms who have been able to really dig in on folks with a pregnancy diagnosis and look at what else is going on. So pulling in mental health claims, looking at, cost per delivery to try to identify outliers. So you could really, look at, do you have communities in which you're seeing worse outcomes? Do you have hospitals that folks are delivering in that are not doing as well? I think another really important metric is how your employees feel. Like I really think it's important to do focus groups if you can, track return to work rates. So seeing are your employees coming back after this experience? And if they're not, what is it? Like what were the gaps that they struggled to fill? So is it mental health related? Is it childcare affordability? Is it workplace supports? I love data, as many of you who know me know. There's just so much that we could track, but I think it really starts with just looking at the pure birth outcomes. We have a client we work with where part of what drove them to implement benefit bump was 25% of their births a year prior were premature, which is just crazy. So those are really good indicators.
Another good question. Delivery hospital preferences are strong. What have you seen employers do to influence behavior change? Preference is strong. Sorry.
So, well, I guess I'll take that. I mean, I think that's the case probably across like a lot of care categories. Like I think every city has its hospital that's like, the preferred hospital. I mean, I think it gets to the ACOs and plan design, so to the degree to which folks through steerage, can drive individuals or help encourage individuals. So I think it's probably, I don't know, I was a big fan of having limited closed network plans as options, to try to foster affordable plan options. And in those cases, you would definitely want to look at where the highest quality, most cost efficiency is achieved. As I mentioned, that one example, like you could incent people, so like, this particular client subsidizes a 6-month rental of the SNU as an incentive for delivering in the preferred hospital. So they have, some other things in place to try to encourage that, but, kind of piling on top something that, employees really love. I don't know, Sarah,
I was just thinking back to the example you shared where in New York City, you could go to a hospital that's performing 7 times worse than another hospital. And so I appreciated your comments there around really digging in to the data and what you're seeing, and then the steerage aspect. So not to sort of mimic what you said, but sometimes that we talk about the leapfrog data and other data that exists and making sure, right, it's baked into the conversation that we're having with, because do you think, Scott, that those moms or those parents know that that quality is, there's such a large gap in quality of the hospital that they're choosing. If they have the ability, right, there are definitely transportation challenges, and I don't want to minimize those. Again, access or the ability to navigate to better healthcare systems in the community, but that's where emergency relief funds can come in. So some of these tie nicely together. But point being, it's the education piece so that folks know where the better care is being provided and can go there. So I liked your comment too around obviously the education and then incenting as well.
Yeah, well, it kind of circles back to that, like easy to digest guide, and maybe, yeah, that's where you could publish that. There was a interesting finding many years ago that I remember where when Bill Clinton was president, he had open heart surgery in New York, coincidentally, and he actually went to a hospital that was in the lowest quartile for outcomes. So even in like situations like that, I think it's hard for people to digest some of that information and act accordingly.
Wow.
But any other questions? I just have one more slide to wrap up on. But April, did anything else come in, or does anybody else have a question before we just kind of make a couple of closing comments? Trying to be sensitive to time. Okay, and this one will be a little bit more, I definitely want to make the connection of, circling back to what I'd shared earlier around employer priorities, and do want to, maybe reinforce why we think we could be a good partner to you all as you support your workforce or your clients. But because we're helping folks with these practical items, the things that they really need to know around their benefits or time off, their well-being, breastfeeding support, all of that, what we're finding is through self-identification, we're getting really high enrollment, including 21% of our participants that sign up before they're pregnant, 70% that sign up early in their pregnancy. So we think we've cracked the code a bit around, if you make something valuable, they're gonna engage early. In terms of enhanced education, as I shared, our navigators are connecting those dots. So they're making sure that folks aren't missing opportunities. They know what to do, when to do, and how to do it. And they're building that trust that's essential to help people with, building birth plans and advocacy. And as we're talking to them about how to find resources for receiving better care, we're in a better position to do that. And we think all of these things are really contributing to why, we're seeing, better results than national average by a pretty wide margin. So sorry if that seems salesy, but we really would like to be part of the way you all are thinking about improving life for your aspiring families and growing families. And our contact information is shown here. And if anybody has questions offline, feel free to give us a call or send us an email. And Sarah, any last thoughts?
No, I mean, I think let's go forth and change it, right? We can see where the challenges are, can identify some of those easier steps to tackle. Obviously, it's going to take some effort, but I think we all have a responsibility, at least that's how I feel about it, to meaningfully move this needle. And there are, Scott, as you highlighted, true ROI value back to the employer from a dollars and cents perspective. So really see these efforts working in tandem with our goals to improve employee well-being and to drive down costs and outcomes for employers. So really appreciate the time from the group on the call. Thank you all for taking interest, and excited to see what we can do together.
Great. Thank you all. Have a great day.
Thank you.